Good afternoon, Miss Carter. How are you?
I'm good.
My name is Rachel. I'm going to be your student nurse today. I'm just going to wash my hands and put on some gloves. All right. Can you tell me your full name?
Sarah Carter.
Okay. And your date of birth?
9106.
9106. Okay, Sarah Carter, 9106. Very good. That matches. And then your medical record number matches your chart as well. Okay, very good. Do you have any known allergies to medication, latex, food, or the environment?
No.
No? Okay, very good. All right, I'm just going to go over your vital signs here with you. Okay, your blood pressure was 115/75. Your heart rate was 50 beats per minute. Your respirations were 16. Oxygen saturation was 98%. And your temperature was 98.2. These are all within the normal limits, so that's good. Okay. Have you been experiencing any pain lately?
Yeah.
Okay, can you tell me when that started?
About 2 days ago.
2 days ago, okay, and where's that located?
In my lower back.
Lower back, all right. And when you feel this pain, how long does it typically last?
1 to 2 hours.
1 to 2 hours, okay. Can you describe it for me?
A throbbing and sharp pain.
Throbbing and sharp, okay. Is there anything that you do that kind of makes that worse?
Lifting or exercise.
Lifting and exercise, okay. Anything that makes it better?
Applying ice or heat.
Okay, and have you tried any medication or treatment for it?
Motrin the day it started.
Okay, so you took Motrin 2 days ago when it started. Okay. So on a scale from 0 to 10, 0 being no pain at all and 10 being the worst pain that you've ever felt, how would you rate your pain today?
A 5.
A 5? Okay. Alrighty. Let's see. Alright, so patient is alert and oriented and no signs of distress, and her body is symmetrical. Do you know what day it is?
Wednesday.
Wednesday, and do you know what time of day?
Afternoon.
Afternoon. Okay, do you know where you're located?
Hospital.
Hospital. Okay, so patient is aware of self. She's also aware of day, time, and place. Okay, all right, so I'm just gonna check your cannula and your IV, make sure everything's properly in place, okay? So cannula looks to be in place nicely. Doesn't seem to be any signs of any skin breakdown, lesions, or edema behind the ears. I'm just gonna check the tubing. There's no kinks in the tubing. And I'm gonna make sure the flow rate matches your chart, and it does, so that's good. Next up, I'm gonna take a peek at your IV. So IV doesn't seem to have any redness, erythema, edema, skin breakdown, or lesions. I'm just gonna check the tubing. There's no kinks in the tubing. And I'm gonna double check that your IV matches your chart. And it does, so everything, the records match the chart, so very good. I do not see a urinary catheter, but if I did, I would make sure that it's properly attached to your leg, and then again, properly, that the bag is properly attached to the immovable part of the bed. Okay, I would also double check around the tape to make sure that there's no edema, erythema, skin breakdown, or lesions. And then I would check the tubing to make sure that there's no kinks in it. And I would check the urinary output and note the color, the clarity, and the characteristics of the urine. Okay? All right. So now we're going to move on, and I'm going to take a look at your hair, your scalp, your skin, your nails, all of that. Okay? All right. So hair looks to be clean, neat, and even. The scalp doesn't have any signs of erythema, edema, skin breakdown, or any lesions. So that is good. Just taking a look at the skin, I do not see any signs of erythema, edema, skin breakdown, or lesions on her arms or legs. The arms are warm and dry, and the legs are warm and dry as well. I'm just going to check your turgor. Very good. So no tenting is present. Very good. Okay, and capillary refill is less than 3 seconds on both fingers and both toes. I do not see any wounds present, but if I did, I would note their location, the appearance, and if there was any drainage involved. Okay? All right, so now I'm going to look at your ears, your eyes, your nose, and your mouth. Okay? So I'm going to start with your ears. I'm just going to look on the inside. Very good. good. I'm just gonna check around the edge. Just let me know if you feel anything tender or if anything hurts, okay? Okay, I don't see any erythema, edema, skin lesions, or skin breakdown. Patient reports no tenderness for that. All right, so just follow my pen for me, please. Okay, very good. If you could just put your hand right there on your, and then just take a peek at a place on my forehead, and I'm gonna look at your pupillary reflex, okay? Very good, I'm gonna do it again on the other side. Very good, okay, now if you could just follow my pen in and back out. Nice. Okay, so pupils are equal, round, and reactive to light and accommodation. Can you just pull down right here for me? Very good, so the conjunctiva is pink and moist, and her sclera is white. I'm going to look inside your nose. Okay, so mucous membranes are pink and moist. I do not see any discharge, and there's no signs of lesions or skin breakdown there. Can you open up and say ah, stick out your tongue? Very good. Can you lift your tongue? Very good. Okay, so mucous membranes are pink and moist. The tongue is intact, and I do not see any skin breakdown or lesions inside the mouth either. Can you smile for me? Very good. Face is symmetrical. All right. So now we're going to move on. I'm going to listen to your lungs and your breathing. Okay. Patient does not seem to be in any type of respiratory distress. She's not using accessory muscles. Are you having any trouble breathing today? No. Okay. Very good. All right. If you don't mind coming up and moving off the bed a little bit, I'm going to listen to your lungs. I'm going to listen in 8 different locations. Okay. So when you feel my stethoscope touch your back, just take a deep breath in and a deep breath back out, okay? Okay, very good. So all breath sounds are clear. I do not have an incentive spirometer, but if I did, I would teach the patient how to properly use it, and then I would ask the patient to repeat that and demonstrate use back to me. Okay? All right, so you can come back up. All right, so next I'm going to take a look at your pulses and your heart, okay? I'm going to start with your carotid artery. I'm going to do it one side at a time, okay? Very good, so rate and rhythm are equal bilaterally, no thrills present. Okay, rate and rhythm are equal bilaterally and no thrills are present there. And rate and rhythm are equal bilaterally and no thrills present there. Okay, next I would palpate the PMI. The PMI is located on the midclavicular line at the 5th intercostal space, okay? So now I'm gonna listen to your carotid artery, and then I'm gonna listen to your heart as well. Okay, so I'm gonna listen to this with my bell, and when, I'm just gonna ask you when I get really close to you, if you could just take a deep breath in and hold it for a few seconds while I listen. So no bruises present. So next I'm going to listen to your heart, and I'm going to listen in 5 different locations. The first one is your aortic. That's located along your right sternal border at the 2nd intercostal space. Then I'm going to move over and listen to your pulmonic. That's located on your left sternal border at your 2nd intercostal space. Then I'm going to move down to Erb's point, located on your left sternal border at your 3rd intercostal space. And then I'm going to move down from there and listen to your tricuspid, which is located on the left sternal border at the 4th intercostal space. I would also normally auscultate the mitral, which is located along the midclavicular line at the 5th intercostal space, but I'm not going to listen to that one today. Okay, so I'm going to listen twice. First time I'm going to listen with my diaphragm, and then I'll listen again with my bell. Okay? Okay, very good. So rate and rhythm is equal bilaterally. S1 and S2 sounds are present with no extra sounds. Okay, all right. So next I'm gonna have you lay all the way down, and I'm gonna take a listen to your stomach, okay, and look. So upon, well, first off, I just wanna know, are you having any nausea, vomiting, diarrhea lately? No, okay. Any kind of food allergies or dietary restrictions? No, okay. And when was your last bowel movement?
This morning.
Okay, and was it normal?
Yes.
Okay, very good. Okay, so upon initial inspection, patient seems to be, her stomach is flat, the sides are symmetrical, and no pulsations visible, okay? So I'm gonna start by auscultating. I'm gonna listen to all 4 quadrants first, and then I will palpate. Okay, so bowel sounds are present in all 4 quadrants. If they were not present, I would auscultate again and listen to each quadrant for 5 minutes. Okay, so next I'm going to listen to your aorta, and I'm going to do that using my bell. Okay, and no bruits are present. So now I'm going to palpate all 4 quadrants. I'm going to do it twice. First it's going to be lighter, and I'm only going to use one hand, and then I'm going to palpate a second time with both hands a little deeper. Okay, so just let me know if you feel any tenderness or anything hurts. Okay. Any tenderness?
No.
Okay. Anything? Okay, very good. So patient reports no tenderness. There's also no sign of any masses or guarding present as well. Okay. All right. Also want to ask about, so are you urinating regularly?
Yes.
Okay, and how many times a day do you normally urinate?
4 or 5 times.
4 or 5 times. Okay, and when's the last time that you urinated?
About an hour ago.
An hour ago. Okay, and was it normal or abnormal?
Normal.
Normal. Okay, very good. I would also monitor intake and output for this patient as well. Okay, so you can sit back up for me. Now we're going to take a peek at your extremities. So just want to ask if you have any signs of swelling, numbness, any tingling in your arms or legs?
No.
Okay, very good. All right, so if you could just squeeze my hands for me. Very good. And then push against my hand. Very good. Push against. Very good. Awesome. Okay, so all extremities are equal bilaterally, and patient's strength is a 5 out of 5 in all extremities as well. So that is good. Okay, so we are done here. I'm just going to make sure that you have your call button. Do you know how to use the call button?
Yeah.
Okay, so if you need anything, just press that call button. We'll come in and help you. Okay, and I'm just going to make sure that the bed is set into the lowest setting, and that your the side rails are up by the head of the bed. Okay. Is there anything else that I can do for you? No, you good? Okay. All right, Ms. Carter. Well, you have a great day. Oh, you know what? I'm gonna take off my gloves and wash my hands real quick as well. There we go. All right. Have a great day, Ms. Carter.
Thank you.